Today, Phoenix Children's Hospital and West Valley emergency crews are running a major emergency preparedness exercise. The hospital is fully open and running as usual, so exercises like this, of course, help ensure everyone is ready to respond quickly and effectively if a real emergency happens. Our David Chasanoff walks us through what's going on there.
It's a very active drill here at Phoenix Children's in Glendale today. You may be hearing lots of sounds and seeing people running around here, but keep in mind it is just a drill. It is not the real thing. And it's also important to keep in mind too, these aren't just healthcare workers practicing here today. We also have fire crews, which is where I bring in Glendale Fire Captain John Chester. Thank you for joining us here today. You know, how important is it to have training sessions like this?
It's extremely important. As rescuers or emergency responders or individuals that do work in the ER, in situations like mass casualty incidents, we typically resort back to habits that have been established through training and drills like today. The Glendale Fire Department is extremely fortunate to be able to partner with Phoenix Children's today. They have collaborated and coordinated with the Glendale Police Department and their officers, the Glendale Fire Department, the EMT and paramedic firefighters, and our transport partners to create this drill to reinforce those habits so that when a mass casualty incident happens, we can resort back to that training.
Having that collaboration between so many agencies, I mean, I got to imagine that's vital to, everyone's operation.
I think in the industry that we're in and what we do for work, we're going to work together no matter what. But when you see these individuals every day, the police officers that we work with and the emergency room staff, it builds those relationships and it makes it so much easier that when we step into an environment, especially like a mass casualty incident, it makes it easier. We've already done this.
Yeah, it's very important. Thank you for joining us here,
Thank
Captain.
you.
Now, I have to explain what these 4 scenarios entail. And, of course, no one knows about this better than Doctor right here. Take me through these 4 scenarios and what agencies are practicing here today.
So we have multiple things going on, as you can see in here. We first got the exposure incident at the high school that is bringing patients into the volume or into the emergency department. In addition, we have local Glendale and Goodyear and Avondale police responding with their SWAT teams to potential threats on the campus of the facility, knowing that in the event of a potential mass casualty, there is the potential for that to become a target for actual threats. So we want to make sure that we have the ability to, coordinate together to neutralize those resources.
What do you want the biggest takeaway to be for someone who may be practicing a drill today for the first time?
So the thing I want them most to learn from this is that this is an experience so that they have some muscle memory should this kind of an event ever occur and we have a large surge of patients. I've already been here before. I know how to do this. We know how to handle this patient volume. We can do this. The next thing that we want to know is what are our weaknesses? What can we improve? Those are the 2 biggest things that I want to take away from today.
And we were just speaking with Glendale Fire, isn't that collaboration everything, especially in emergency situations?
Absolutely. We work very closely with our local EMS personnel on a daily basis. They're constantly bringing us patients. We rely on them to provide critical communication to us. And so that partnership on a regular basis is vital. In this situation, ever more critical.
Absolutely, and important to note, while we may be seeing, SWAT team members here today and people running around, it's still business as usual.
Absolutely, we're still seeing patients and providing the same high-quality, excellent medical care that we do on a regular basis. Absolutely.
Okay, well, thank you so much for joining us. We'll send it back to you guys. We are in Glendale. David Chasanoff, 12 News.
Totally real simulation. David, thank you.